All right, I'm waiting for my next patient. So let's talk about the difference between the gel and the patch. So what are the similarities? They're both the same medication. They're both FDA approved, bioidentical estradiol. Now, bioidentical is a term you might have heard. Bioidentical is a slang term. It is actually not a term that we learn in medical school. It's not a pharmaceutical term. It is a marketing term that was made up to get you to buy it because it sounds good, right? Like, it's bioidentical to me. It just means that the main ingredient, estradiol, is plant-based versus conjugated equine estrogen that comes from horse's urine, which is where Premarin and Prempro, that's the main estrogen in those medications, right? So you can have bioidentical estradiol that is FDA approved, and that is what we do with the collaborative. That's my private telemedicine practice, and that is absolutely what we recommend. I can do a whole nother video on why I recommend that, but there's nothing special with compounding. Everything you get is going to be a little different. Your doses are going to be different, and there's no long-term studies on them. Longer video if you want it. So they're both bioidentical FDA approved estradiol. One is in a patch and one's a gel. So let's kind of go through the difference. So the patch, there's two kinds. There's twice a weekly and there's weekly. Most of the time, I prefer my patients use twice weekly because I think by like day 5 or 6 of the weekly patch, it kind of tends to like run out a little bit, even though it's not supposed to, unless you're a girly that cannot remember to change your patch. If you're a night worker, if you have ADHD, go with the weekly patch, because if you're given a twice weekly patch and you do not remember to change it twice a week, you will probably, or you definitely could get some bleeding. So it can cause a lot of disruption in the estrogen levels. So the twice weekly patch is a little bit smaller. It's probably about the size of a quarter, and the weekly patch is a little bit bigger. And I usually have my patients put it kind of right on their abdomen. So if this is kind of where your pants are, you'd probably put it like here or here. Some people put it down here or here. I kind of put it here. If you want to put it on your tushy, you can put it there. If you like want to wear a bikini and you don't want it to show, although it is clear, and most of the time people don't really notice it, but again, we all have preferences. You know, I would say about 40% of my patients use a patch, 40% of my patients use gel, and about 20% use oral. So patches are really popular. They're really great if you take a lot of medications orally and you don't want to take another one orally. They're great if you are totally new to HRT and just like putting a little patch on feels so much better than like this whole daily ritual with the gel. The downside I find to the patch is sometimes it doesn't stick well. Some people get this like ring of adhesive, and like, girl, there's other methods beside the patch. And if you're getting all these like circles and these welts, like, let's please move you to something else. There's other options, right? So it's a nice gateway. It's a nice place to start. The other thing I find with the patch is sometimes patients get uneven levels. What does that mean? I almost feel like sometimes they get this whooshing sensation from the patch. Like they put it on and they whoosh, say like for the first day and a half, they get all this estrogen. And then the last like 2 days, it's kind of running out. So that's another downside to the patch. All right, let's talk about gel. Now, I don't have a gel packet with me. I usually have one on my desk. So, but you know, if I were to, this is like a little Clinique thing for my face, but it's kind of a little packet. Each packet is something you would use once a day, and you're going to apply this to your thigh daily. So either at night, if sleep's a big problem, is when I usually recommend it. In the morning, if like daytime and brain fog's more of your issue, and you're just going to open each packet and you're going to put it on your thigh. I usually do the upper inner thigh, and then you're going to let it dry. So for me, I'd probably just do it at night, walk around in my undies, and then like, you know, take off my makeup, brush and floss my teeth, and by then it should all be absorbed. So it really takes about 5 minutes for the gel to be absorbed. Remember, this is moisturizer. I'm just using this as a prop. And then it's nice and all absorbed. And so you can put on your jammies. You won't get it on your partner. You won't get it on the sheets. A lot of people worry about transferring with the gel, and I really don't see that. The gel is really nice because I think it tends to give a little bit steadier levels because every 24 hours you're putting on a new dose. And really, because I see so many doctors initially prescribe the patch, kind of like patch to everyone, patch to everyone, patch to everyone. They don't think about gel. There's also a spray. There's also a ring that goes in the vagina. There's actually lots of different options. The patch just doesn't work for everybody. So, you know, if you're kind of like, this kind of works, but kind of doesn't, or I'm having some of these side effects and I don't really love it, like there are other options for you. I just did a whole podcast on like oral estrogen, why I take oral estrogen. So if any of these topics are interesting to you, definitely let me know in the comments and I can do a longer video. What I say to my patients all the time is I am more than happy for you to like experiment with each different one. Like as long as you've got the bandwidth and the wherewithal and you're like ready to go, because it does often take some trial and error. Like you might say, how will I know if I'm going to be better on gel or patch? It's all about how you absorb and how you live your life. And it's just based on so many individual factors that we don't even know the answer. So at this point in 2025, it really is still trial and error. I've seen people on the patches for years, they switch to the gel and all of a sudden, like it's like a light bulb turned on. They do so much better, and vice versa. It's not that one is better than the other. So I know you're probably thinking at this point in this video is you're like, well, which one's better? Which one's more effective? No such study exists. And in my experience, again, it's all individual. So what might work for you might not work for your best friend and vice versa. So you've got to find a clinician who is really okay with like trialing things out and being curious with you as long as you're still doing these things safely. Remember, if you have a uterus, you should be taking progesterone with these. And I'm Dr. Hirsch and I have private telemedicine practice. We're open in almost all 40 states. 40 states, it's in flux. But you can find all my resources and I hope that helped, guys.